Hi, YouTube people. Oh, you're right, me. Now that all the excitement is left the house, my nerves are really super calm. Let's talk about autism. And I wanted to offer insight to parents who have autistic children and they have a really hard time trying to handle them. And basically, with autism, my kind of autism is a dullness of my senses. You see, I've got pads everywhere because I can't tell when I'm wet, and I have to wear a diaper because I don't know when I need to go use the potty. But I can't tell when the diaper is wet, so pretty much my clothes get wet, and I got these pads so nothing else does. I have to constantly wash my clothes in the pads. These are all free by Choice. Commercial. This awesome company gave me $200 worth of credit to get any free thing I wanted from the catalog. And I got $200 worth of pads. This was for old people. I'm not actually old. They stuck me on old people's insurance. So I think just to start off, when my autism got increased after the anthrax vaccine, and I didn't know about food and stuff, and I got totally assaulted by all kinds of things. That's cool, but every time I lean in, you can't see me anymore. Oh well. I had an effect where I couldn't speak very good. I really struggle with making my mouth move when I'm trying to speak. I mean, it doesn't really want to move. And I got this really great physician, and I thought I'd go ahead and put a plug in for this thing. It's in other videos, and I'll splice in the little zoomed in paper thing. So this is a Medic Pro therapeutic trainer, and for autistic children you can go out, you get them a pacifier. It works good. This one is for adults. They use it mostly in Europe. It's used in institutions mainly. That's why it's really hard to get one, even online. I went to, it's made by Nook. I went to the Nook website and it wasn't listed. All they had was kid stuff. So I was like, where do you buy them? I don't know. It's called the Medic Pro. Professional something. I think if you look really close you can see it on the picture. But yeah, what you do is you put it in and it causes your mouth muscles to be moving. It develops these muscles right here, which, because my brain sending nerve pulses around my body, it doesn't do that, so muscles get weaker and weaker, like skinny arms. So muscles I'm not using get really weak. How do you use that? I could just chew food and stuff, but this gets used all night long and most of the morning, and my belly would be too full to do that with food. And I don't like gum. It wears out or I accidentally swallow it. I'm always choking on gum, which choke on gum and hard candy. A terrible choking problem. So, this is what was recommended. Used in institutions over in Europe. I don't think it's all that popular here in America. The second best therapy for a person with autism, like when your brain is losing the pulses, it can't tell what your body wants or what your body needs. It doesn't know anything. So what you need to do, turn yourself upside down. Now your brain can't process anything because it's too confused. It can't figure out what's going on, and I just totally shut down my brain's ability to think erratically. So I can just sit here totally relaxed because my brain is too confused to think erratically right now. And it's totally relaxed. This is what I would recommend, especially for autistic children. It give parents the ability to bond with them because you hold them upside down. You can flip them, you can spin them, you do all kinds of things. Basically what you're doing is occupying the mind. The mind is what's messed up. It thinks too much or something. I really don't have any clue what it's doing, but if it's not thinking about something, it's panicking about something. Worried about things that don't even need to be worried about. I'm still working on the dismount though. That looked rough. That happens every time. But I have a barely sense pain. I can't hardly feel pain at all, so that kind of plays into it. I think that would have really hurt a normal person. Landed on my head, my shoulder. Doesn't bother me. So I give some really good insights into autism, though. What is it like for me? Really hard to describe. It's like one of the hardest things to describe. I'll be sitting somewhere, I'll be walking somewhere, and there's no sound, there's no stimulation, and it's kind of like my brain is craving for stimulation. It really wants to be stimulated. It may be for the fact that it can't communicate with the rest of my body. My brain has a problem communicating with the lower half, with the stomach. Doesn't know when it's hungry. It doesn't know when I'm tired. It doesn't know almost all my needs that I have. My brain just doesn't know. And sometimes it's really frustrated, and creating stimulation is something that I seem to do spontaneously, and that might explain why autistic kids make noise, because when all this is going on inside of my head, I can just go and it totally distracts my brain from what it was thinking about. And if it's really, really busy, I just keep doing it over and over and over till I can make it stop. Because internally, I can't find the control switches on my brain. I can't figure out how to make it quit doing things that it doesn't need to be doing.